think you could kind of divide the bill into really two phases. The first phase is what I was talking about a little earlier with the new requirements on the insurance companies, this requirement that you have to have cover people on page 26 under their parents, the MLR, the medical loss ratio floors, so that 80 or 85% of dollars have to go to medical costs, and those type of requirements on the insurance companies, and that's sort of the first phase, the first 3 years. And then the second phase is this whole question of the exchanges. And the exchanges are, I would say, very much up in the air. It's unclear exactly how they're going to play out. Are they going to be more national, more state-based, exactly how they're going to interact with each other? Will states have more flexibility to have variations within states, or will they all go along the same model? So I think these are some open questions that will be determined in the next couple of years in the implementation process. And what I saw when I was over at the Department of Health and Human Services is that leadership at the department can make a huge difference in the way the implementation plays out. I know with the Medicare prescription drug Part D coverage that came about in 2003, 2004, it initially seemed like it might have been going in a bad direction. I know there's a lot of confusion about it. And then I remember Secretary Leavitt, who was the secretary at the time, he would spend his Saturdays every week and roll up his sleeves and work with the career officials who were writing the regulations and make sure that the regulations were written in a way that seniors could understand, because the whole premise of the Part D plan was that people have to go make choices. And what we found was that 90% of seniors did go and make choices, but that's because the rules and the instructions were written in a way that people, for the most part, could understand. If it's written in a way that people can't understand, people aren't going to participate. So I think what you can see in rules is there could be relatively minor variations in the wording, but can lead to very wide consequences or effect in how they actually shape out. So I think it's important to watch that complex process of these many different rules and many regulations that are in the process of being implemented. And this is only one of two dynamic processes that I think are going on. One is this question of the bills passed, how are the rules going to be written, what are the regulations going to look like at the end of the day, and we don't know the answer in all of those cases, and we can't know. Anybody who tells you I know exactly how this regulation can be written is not telling the truth. It's just not clear yet. There are too many twists and turns in the process. But then the second question, the other dynamic process, is the marketplace. How is the marketplace going to interact with this whole new set of stimuli being thrown out there? What is going to happen? What are companies going to do in this area where you now have this opportunity, or this ability, I guess, to drop your health coverage if you pay a penalty or a fee? One would hope that companies don't do that, and they continue to provide health insurance for their employees. And all studies show, or surveys show, that employees are very happy with employer-provided health insurance. But I saw one analysis that showed that there's one company that spends over $2 billion a year in providing health insurance to its employees. And they've calculated that if they wanted to pay the penalty, it would only cost them $600 million. So while it's a generous company that likes providing health insurance to its employees, it has a real business decision to make, to decide whether it wants to continue to provide health insurance or just pay this penalty. And the penalty is a bit of an opt-out. And I think that is one of the sort of the question marks. What's going to happen? Are people going to continue to provide health insurance if they find that paying the penalty is a better deal for them? And then there's the question of the covered individuals. Are they going to stay in their plans, or are they going to be moving towards the exchanges, which for the most part are government subsidized? That will have an impact on the overall cost. Dr. Koo mentioned an interesting issue at the end about Medicaid. He said that there's a lot of people going to be moving to Medicaid. I believe about 16 million people moving to Medicaid. That's half of the newly covered people as a result of the bill. And then he said that initially that the bulk of that cost is going to be covered by the federal government. And then it's unclear what's going to happen down the road, is how much of an imposition is that going to be on states. I know a number of governors were very worried about the bill, saying, well, the federal government says they're going to pay up the costs, but that's in 2010, 11, 12, 13. What's going to happen in 2014, and what's that going to mean for our state budgets? So I think that's another one of those open questions in this sort of dynamic process of how the bill is going to play out. And then the fourth question is the question of cost. I just saw in the newspaper on the way over here that there's a new study by CBO that says that there's $115 billion in additional costs to the bill that are just in discretionary costs. That means costs to the departments, largely the Treasury, the IRS, and Department of Health and Human Services, who have to implement the bill. And you know, the things that they have to do to make the bill happen will create a whole bunch of new costs on them. That's not included in that initial $1 trillion. The way Dr. Koo explained it, it came from the CBO, was the cost of the bill costs about $1 trillion, and half of that comes from Medicare savings or cuts, depending on who is explaining it, and then the other half comes from tax hikes. So there's a lot of things that have to go right to make that $1 trillion balance out, and it may not do so, and then we see these additional costs through this discretionary thing. So basically, again, in conclusion, I will say that I come down strongly on the first stirrings part of the question. I don't know if anybody would say that this is the final word, or so it's sort of a false question to begin with, but I think that I think there's a lot of pieces in the bill alike. I think it was terrible that we didn't have everyone covered in this country. We're still not going to have everyone covered at the end of the day, but we'll have more people covered. But the question is, how exactly is it going to play out in the years ahead? And a lot of these questions are unknown and unknowable. So that's it for my speech.